Good morning, ladies and gentlemen. We warmly welcome you to the 224th session of the weekly Sunday webinar series organized by the Society for Health Research and Innovation. Before moving on to the lecture, let me walk you through some of the housekeeping rules. The webinar link will be available from 9 a.m. to 9:50 a.m. for you all to join in, and no late attendees will be entertained thereafter. Each attendee should have been attended till the end of the webinar to obtain the certificate for CPD points. And the CPD points are strictly adhered to the NCCPD guidelines. We thank you for your strict adherence of the CPD regulations and your kind compliance. This is to improve and maintain the standards of the CPD programs conducted by the SHRI. Regarding asking questions, there will be a question time at the end of the webinar. If you have any question, you can type it in the chat function. And if you have any specific questions about your situation, you can email us on officeshri13@gmail.com. Today's topic is a very interesting one, not just background music anymore, music therapy in medicine. This is done by Dr. Nilanka Anjalee Wickramasinge. She entered the Colombo Medical Faculty after ranking 15th in the district and 34th in A-level biology stream. She graduated with second class upper in 2014 and later earned MSc in Human Nutrition, winning 2 gold medals for academic excellence. In 2018, she became a lecturer in gastrointestinal physiology at the University of Colombo and recently completed her PhD in the same field from the University of Kerala. She currently provides clinical GI physiology services at the National Hospital of Sri Lanka. Over to you, Dr. Nilanka.
Thank you very much for that kind introduction, and also thank you for inviting me. Thank you for Shri for inviting me to this session. Let me first share my screen. Okay, so thank you for the patience until I started my topic. So today's topic is on not just background music anymore, but we are talking about music as a music therapy in medicine. And I think you introduced me related to my academic qualifications with relation to music. But the audience might wonder why a person in nutrition and GI physiology is talking with relation to music. And I'm not boasting here, but I think I should tell my academic qualifications related to it for you to get a better understanding related to my role in music. So I learned music from a very early age, and I obtained my LTCL or licentiate diploma in singing, opera singing from the Trinity College London. And also I obtained my associate level diploma in piano music, again from the same Trinity College London. Now, for someone who's not familiar with these things, this would be in the level of something, say, Visharada in the Eastern music setup. And I have dabbled with original songs and also cover songs in both languages, Sinhalese and English. And I am also, I would say, currently a performing artist. I don't have much of a huge audience, but that's enough for my ego. So coming back to the talk, I would like to talk about the composition of my talk today. I will divide it into 2 parts, and I will talk about first the basics, that is the physiology of music, hearing, and the brain. Once I've done that, then we will go to music therapy and its many uses. I believe that this first part is essential for us to go into the understanding about what music therapy is. So moving on to the physiology of music, hearing, and the brain, I will go from physiology to physics first. So physics related to sound. You all know that sound is a sound wave, a mechanical wave, and this wave has a frequency, amplitude, and a waveform, which will in turn give us certain aspects of sound which is heard by our ear. So related to frequency, frequency is what we hear as pitch. The name we say pitch is related to frequency. So if you say sa re ga ma pa da ni sa, sa will be a lower pitch, with the lower frequency. Sa will be a higher pitch with a higher frequency. And the other part of the waveform related to amplitude will give us an idea about loudness. So if I talk loudly, that means more sound waves. My sound waves are now louder. And if I talk softly, it will have a lower amplitude. Then related to the sound wave again, the waveform plays a role. And this waveform will give us an idea of what the source of the music is and how it's produced. So you can see the waveforms of different music instruments are different, and our auditory cortex has the capability of identifying these as, okay, this is from a flute, this is from a clarinet, and this is from a saxophone, etc. So if we go back to first year medical physiology, sound waves will come through our outer ear. It will vibrate the eardrum. It will vibrate the malleus incus stapes, and then it will enter the inner ear. And in the inner ear, we have the cochlea, which is the receptor for the sound here. And the cochlea is like a coiled shell, or we could call it like a snail's shell. And if you uncoil this and stretch this coil out, or stretch this tube out, it will be something like this. And when the sound is heard or understood by or received by the sound receptors or the neurons in the cochlea, that will be sent via the vestibular cochlear nerve that's the eighth cranial nerve to the auditory cortex. So like I told you, if I uncoil this and stretch it out, it will be something of this sort. So this is your basilar membrane, and the basilar membrane is made out of little reeds like this. And at the base, the reeds will be shorter, and at the apex, the reeds will be longer. And if I compare this basilar membrane to a musical instrument, it will be the xylophone. So you all remember this xylophone, X is for xylophone. So the short ends are here, the long ends are on this side. And if I were to play this xylophone, so let me show this video. Please let me know if you can hear the music.
Do, re, mi, fa, sol, la, ti, do.
Okay, so you heard that.
Do.
Okay, stop that. So you heard that the do will be, the higher sounds will be somewhere, the shorter ones, and the lower sounds will be in the longer area. So if I come back to this part, so the low frequency will be heard at the apex, and the high frequency will be heard at the base. So you can see the basilar membrane is vibrating much at a wider amplitude near the apex, and it will give you a low frequency sound in this case. And a high frequency sound will vibrate this basilar membrane near the base and give you a perception of a higher sound. So this xylophone can be carried out again to our brain as well. So if I were to determine the pitch, the auditory cortex is also placed in the same topography. So we'll have, this is slightly twisted from the previous picture. So higher frequencies, you can see the higher frequency waveform here will be at the base of the cochlea, and say it's around 16,000 hertz here. And like that, the hertz numbers reduces, and the lower frequencies will be heard at the apex of the cochlea, and you will hear lower frequency sounds here. So this determination of pitch is also the neurons are in the brain are specifically mapped out for this. And it is said that an average person can distinguish about 2,000 pitches. However, a musician or a trained musician can hear more. And that is why a trained musician or will start wincing if someone destroys the singing and sings flat. So if we hear someone singing flat, that means we hear that he or she is not pitching it correctly, but he or she who's singing flat will not identify that the pitch is not pitched correctly. I don't know whether I'm mixing up my words. So if you hear someone singing flat, and if you understand that that person is flat, you know your auditory cortex is, I suppose, much better than that other person's auditory cortex. In the same way, music is not only about hearing, music is also about producing it. So if I were to play the violin, and if I were to produce a note, say middle C, the note middle C, my hands and my muscle memory will know that if I play it in this particular position, in this part of this string, and in this area, that it will produce a middle C note. And this will be confirmed when the middle C is played by my own ear, which will say, okay, yes, you're playing the middle C, or we can say, okay, it's still not middle C, I'll have to tune or tighten the string much more. Likewise, if you're playing the guitar, your fingers will have a muscle memory of, producing that particular note. And this picture, though it does look like some part of the female anatomy, this is actually a visualization of the vocal cords. The vocal cords, these slightly white tended like things are the vocal cords. And by our muscle memory, we can increase the tension or decrease the tension or change the position or whatnot, and change the frequency and the loudness, etc., of the sound vocal cords and the sound produced. So that is about how we produce sounds. So all of these things come back to the brain, and our primary auditory cortex, somewhere over here, will identify the basics of the sound, including the pitch and loudness. But it is not only this part. The entire brain almost is involved somewhere or another. So you know that music is not just sound waves. There is lyrics, there's language. So you would, if you're singing your Broca speech area, all of those will be involved. And we also have something called secondary auditory cortex or auditory association areas, which are some things like your Wernicke speech area, which will give you about comprehension. If you want to read the lyrics and sing, then the angular gyrus will give you an understanding of the reading and the language. And the planum temporale is also supposed to be talking about this language and music. So there are many parts of the brain which come into play. Now you would have seen that I changed my tune from sound to music. So what's the difference between music and just sound or just noise? So music is, I would say, a specific form of organized, often aesthetically pleasing sound. So there is an organization, a predetermined, a nice organization, as opposed to just noise. And there are several components of music. I'm just mentioning a few here. One major thing would be the melody or the tune of your the song you're listening to, the tempo. So the tempo would be, say, like a fast song or a slow song. Then the rhythm. Rhythm is, say, if you're playing a 6/8 beat, whether it's a baila rhythm, you will be doing some baila dancing, or whether you'll be doing a slow waltz for a 3/4 rhythm. Then the lyrics, of course, will have an emotional component, whether it's a sad song, a happy song, whether you're singing for your father, to your father, or whether you're on Father's Day, or whether you're singing to a boyfriend. And then the dynamics are different. Dynamics here is about the loudness, the maybe you're making it husky, maybe you're singing it loud and like kind of a Chitra Somapala way, I suppose. And then texture is another component which is related to, say, the harmonies you're using. How many, is it a choir, is it a solo song, or how many instruments, is it an orchestra putting in? their sound waves altogether. So you can see music is an entire area of its own. So because there are so many aspects of music, if you play and listen to music, it works several areas of the brain, and I will take them one by one. So starting over here, the auditory cortex, it will listen and perceive the sounds. And if you're playing music, your sensory cortex will give you tactile feedback. Your motor cortex will be involved in playing the instrument. And of course, your corpus callosum will connect both sides of the brain. Then if you're reading to music, or if you're looking at your dance moves, you are looking at the visual cortex. And your dance moves or your playing to smoothen out the actions, we will use the cerebellum. And all of this will give rise to music, where music has certain music memories. So if we listen to, say, Summer of '69, I don't know, that is something which gives me a music memory. So I remember dancing at parties at faculty for Summer of '69. And that's a happy music memory. So that's will give the hippocampus. And that music memory in turn will be involved with emotional reactions to the music. So you will feel exhilarated probably when the Summer of '69 song is being played, and that is through the nucleus accumbens and amygdala. And of course, that in turn will help the prefrontal cortex make decisions related to behavior, your expression, whether you're going to stand from, get from your seating position and go to the dance floor, and your decision making and controlling of behavior, etc. So you can see just this simple act of, say, playing an instrument or dancing to music or just singing or maybe just listening to something works many parts of the brain. And of course, this emotional component is a major part of our life, and that is why music is a big deal for human life in our social context, in our personal context, etc. So it can make us happy, sad, angry, etc. So getting back into physics, physiology, it is said that musicians have a better or more areas are involved if they hear a sound. So this brain is supposed to be a non-musician who's listening to something. And this is the functional MRI of another musician, and you can see more parts of the brain in that person are used up when that activity comes into play or when he's hearing some music. Let me show some more examples of what is a word called cortical plasticity. And what does that mean? Cortical plasticity is where we are getting many parts of the brain to get together and work and, I suppose, grow in function. And so for an example, you can see that this musician is playing the piano without even looking at his hands. Closing his eyes, he knows that if he does like this, the sound will come like that. He doesn't need to even read music. He knows that if I play this part, I will get this sound. Right? So just imagine how much of plasticity, cortical plasticity has gone through to just get that level. Right. So here, musicians are said to have an altered somatosensory representation of the area, so that they know when their fingers are playing these particular instruments that this the somatosensory representation will be going to, say, middle C or the tempo, etc. And that is why it is encouraged to start children at a very young age when your brain is ready to accept anything. So most children, why we send them for at a very young age to music classes, is to get this plasticity, all these neuronal connections starting at a very young age. So that's an example of that. But however, that does not mean you're too late to learn a musical instrument. Even at middle age, if you get, or even at an elderly age, we can still learn an instrument, and the more we practice, the more our connections will come across and more we will get some cortical plasticity going on. I don't know whether chat options are, the messaging options are there, but would anyone know who this individual is? This is a Grammy Award winning musician who who made the song Dancing on the Ceiling, or Lady in Red, that song. And he's blind since, I think, shortly after birth. And even despite that, he's considered one of the greatest musicians. So thank you, Steve Wonder. And it is said that individuals who are blind could be better musicians, because they're blind, their visual cortex is not working, so they're solely relying on their auditory cortex. So their auditory cortex is like a superpower, and they are said to identify pitches, the amplitudes, everything much better than a normal person. And so I don't know the advantages. And on the other side of it, another example of auditory plasticity in humans would be that, say there's a human who's deaf. If he or she learns the sign language before language skills are fully developed, if they do the sign language, those sign language motor movements or those visual messages of someone else doing those sign language movements activates the auditory association areas. So just imagine that the visual or the cortical movements can apparently stimulate the auditory association areas in a person who's deaf. So this is one importance, one place I would like to stress the importance of identifying hearing impairments at a very young age, because these plasticity issues, plasticity activity is much better at a younger age. So I hope I gave an idea of the basics physiology of music, hearing, and the brain. And with that, I would like to go to the latter part of or the second part of my talk, which is on what is music therapy and its many uses. So if I asked Google, what is music therapy? Nowadays, AI gives us an overview. And sorry, someone is annotating. I would please, can someone erase that? Srina, so it's, I think, by accident. Okay, thank you very much. Music therapy is, if I just read this definition, what AI is giving me, it's a specialized approach that uses music to address physical, emotional, cognitive, and social needs of individuals. And it's said to be done with a certified music therapist, and to achieve, say, medical goals. And interventions can include singing, playing instruments, listening, etc. So we talked about a certified music therapist. So this is a very gray area. Like, there are many psychologists in Sri Lanka from different places. So one part of that Google page says that the American Music Therapy Association can certify a music therapist. So from what I realized, that in America you have a board certified music therapist. You can do you have to have a basic degree or qualification in music, in an instrument or something of that sort related to music, and then they will train you related to the medical aspect of it and in the practical part of it, and you will be board certified after a training period, or maybe sort of an internship of sorts. However, this is not there in Sri Lanka, and I believe this is a very gray area of how you will certify yourself in various countries. Whatever said or done, there are many benefits of music therapy which are shown in various studies. Again, these studies, the quality of these studies, whether they are actually scientific or not, depends. And many of the systematic reviews, though they give positive outlooks, it's a very heterogeneous area of how music therapy is applied. However, music therapy can be divided into, say, receptive or active. So receptive means you will just listen, whereas active means you will not only listen, but you will actively work on it. Say you will sing, or you will dance, or you will have a group activity of sorts. Now, this is music therapy in medicine, but let me just go to music therapy in our day-to-day life first. Right? So, to a baby, we sing lullabies as a mother. We sing doi 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 baba, bye 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 baba. We will sing like that. You will notice that my tempo is very low, very slow, that my volume is quite low, and it is soothing, it's not jarring. And certain studies have shown that a low volume or a low tempo will activate your parasympathetic pathways and make you feel relaxed and stress-free. And that is why we sing like that for a baby, a slow volume, slow rate, instead of saying doi 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 baba or something of that sort. That's not going to rock him to sleep. And when we talk about rocking, sometimes mothers not just sing, they use the hand to rock the baby, and you get a kind of a movement pathway also. So that was about waking up babies also. So correct me if I'm wrong, if I'm misinterpreting this, but I believe Balitovil is a form of, say, an cultural active form of music therapy. So here we would have a patient probably psychologically depressed or something of that sort. And in this Balitovil, we will stimulate this person with fast tempos, yaka dances, and the lights and the fire, and stimulate that usually kind of a depressed person, and we'll get that person I believe the success of a Balitovil is if you get the patient to just get out of that stupor and come out and dance and let go of, I suppose, the devil that is in him. So they lose their social inhibitions and they will start dancing. The music, the dance tempo, the whole thing is geared to get you out of your stupor and into a dancing mode, and then your quote unquote cure. So if someone thinks that I misinterpreted this, please let me know in the chat box. It is not my intention, but this is just simply my idea of what Balitovil is like. But we don't have to go to Balitovil levels to use music therapy in our day-to-day lives. You know that if we listen to music, we will feel happy. So if we are going on a trip, we will listen to happy music. Or if we know that we are kind of unhappy, maybe we'll listen to happy songs to make ourselves happy. On the other hand, if we are unhappy, we can use sad songs to actually ventilate our feelings. We can listen, if someone broke up with me, I'll probably listen to sad songs and sing with that, sing the lyrics of Anta and Payan or something like that, and get that grief out of my system or ventilate it out. So that is also supposedly a form of therapy. And rock music, we all talk about hard rock, metal, and there is again, if you go to rock concerts, they will do their head banging, head shaking, they will jump, they will dance. So that is also, I suppose, a form of letting go of emotions, maybe your anger. So one song I really like when I'm angry or when I'm upset is listening to Linkin Park's Numb. I've become so numb. So that's a great cathartic song for me to get rid of my rage or something like that. And I will sing it in the car very loudly. Okay, sorry about that personal disclosure, but yeah, that is a form of therapy for me, at least. Then on the other hand, music can be used to relax and wind down. And if you go to a spa, if you go to a meditation center, all these music, the background music in those areas will have a slow tempo for relaxation. And it is generally said that the beats per minute are about 60 beats per minute, which is like the heart rate you want to relax. And this is said to associate alpha brain waves and are linked to a kind of a relaxed and a conscious state, etc. And it will calm your thoughts down and promote a sense of calm. On the other hand, if you want to run, you would not listen to calming music. So rather than just running without any music, people like to listen to music. And if you think of the music you are using, you'll be using a high tempo music. So it is said that music with say 130 beats per minute average would be good for a workout, because that is like your activated heart rate or your high heart rate. And sometimes if you listen to it, it will make you run to that tempo and get you more in the mood for doing that exercises, and probably get your parasympathetics activated. So that is part of how we can actually use fast songs to get into exercise. And this is actually scientifically proven by certain studies, where the effects of music on pulse rate and blood pressure in healthy adults were studied, and they found that there was significant reduction in pulse rate and blood pressure after listening to slow music, whereas there was a significant increase in pulse rate and blood pressure after listening to fast music. So that was about day-to-day life music therapy. Sorry. Now, coming to what is music therapy in medicine, I would like to tell you all that there are many examples that can be utilized. And I'm just going to tell a few, and I would like to show some videos also in between. So I would like to categorize these examples in an age group. So if I were to start with children, babies, studies have shown that even prior to babies being born, if you put music, if you listen to music, and in pregnancies, that please look at the highlighted area, that it will form stimulus-specific memory and affect the neonatal neural system. And there are playlists called Mozart for babies or Mozart during pregnancy. Now, it's not only Mozart. People talk a lot about Mozart, but there's actually no proper, from the research I looked at, there is no proper evidence to show that Mozart is better than other music. I suppose since he's such a famous person, people are using Mozart. So there are playlists for pregnant mothers to use when they're having to play for their babies and to stimulate them. And once they are born, also music therapy can be used. So please, there's another annotation if that. Okay, thank you. So music therapy in Western countries, they use it in the ICU. So you can see this lady is playing a guitar. Now I'd like to make a point here that it's not just simply listening to a radio. When you listen to live music, the waveforms are different as opposed to, say, a recorded music. So that's why people would pay and go to listen to an orchestra play live in front of them, because the orchestra sounds are actually kind of sending their sound waves across. I suppose there are what do you call, speakers as well, as opposed to just maybe listening to the same sounds on the radio. So sound waves, I suppose, are better when it's near you. So you can see an example of this. And it's found that preterm infants who were subjected to music therapy in the systematic reviewing had significantly improved heart rates, respiratory rates, stress levels, and also increased oral feeding volumes. So maybe in our Sri Lankan ICU setups, this is something very easy to do probably, and maybe we can do some research on this. So I'm going to show a small video clip which shows.
If the baby's really fussy, so today he was really fussy because he wanted his milk. And so we started singing the Song of Kin to try and get him to remember, oh right, this is the time when I calm down. As I'm doing all of that, I'm constantly looking for signs of overstimulation because we do not want the baby to be overstimulated. Then everything we've done basically goes out the window. We did some feeding facilitation with Miles, and I used the Gato box, which is a major third, and it simulates the heartbeat. It's also really great for sucking behavior. And so what I do is I pace with him when he's sucking. I start out, each suck, I tap the Gato box, and I entrain with him. And then, as he's going, he starts to entrain with me so that I can get him to pace.
So that was a clip of how a music therapist is working in USA. So if you go in the life cycle to, say, a slightly older child, music therapy is said to be helpful in children, say, with autism spectrum disorders, and they can improve their social, emotional, behavioral problems in that. And in maybe children with Down syndrome, in systematic reviews, they have shown that again, social, emotional, motor, cognitive communication has improved in children with Down syndrome who were subjected to music therapy. So I will show a video of a child with a development delay, how the music therapist gets that child to communicate. So I hope please bear with me. So I hope you enjoyed that. Despite it was just someone just singing with that child, there were so many components which was addressed, and it's a very personalized but a very mindful way of using music. So I'd like you to go to this shows group music. The aspects they are addressing are written in the corner of the board.
Sit down. Easy. Touch your head. Together. Put your hands on your knees. Ready?
Put your hands on your nose. Your hand. Can you find the F? Like the F. What is
Light green.
light green?
green.
And Kobe, can you find the E? And Nani,
Yes, Sim.
can you find the D?
D. Sure.
So I kind of fast forwarded it due to time's sake, but it's actually a true joy to look at that and see how kind of a non-verbal, shy child, say with autism spectrum disorder, uh, learns social skills, development skills, communication, leadership, group work, etc. through this music therapy. And as you can see, music therapy, it's not an expensive thing. You just needed some guitars and some things to bang on. So I hope this will encourage people to think about this more. So let's move on in the life cycle to adults. And here I will just show some research findings in various situations. So this is a systematic review where they have found evidence of music therapy in perioperative pain and anxiety, and they have found that music reduces preoperative anxiety. And this is something easily we can do by in our setup by maybe having some music in the operating theater or in the waiting areas. It's simple as that, right? And I'm sure the advantages are many. And then music therapy, there are systematic reviews for findings related to many mood disorders. So this shows that there are short-term beneficial effects for people with depression. And, it's again a simple thing we can add. Then how about in pregnancy? It's shown that in this systematic review, it's shown that music therapy has advantages in reducing pain during childbirth, lowering anxiety, stress levels in mothers, improving sleep quality, increasing fetal movements, basal fetal heart rates, and acceleration. And I mean, we might not have certified music therapists in our country as such, but we can probably have a music background music going around in the labor rooms, I suppose, right? And then what about music? I'm sorry, a lot of people are chatting online. I'm wondering whether, okay. Okay, music as a medicine. So apparently, if you listen to music at least 30 minutes a day, the American College of Cardiology, this is an article there, which shows that it reduces anxiety levels after a heart attack. And then even in cancer treatment, this is a systematic review which showed that patients with colorectal cancer had reduced pain and anxiety after music therapy, and which will help in their management, I suppose. And then a major part of it comes in neurological music therapy, in neurorehabilitation. So this is taken off the Brain Injury Association of America website, where they talk about music therapy. And here they have actually listed out populations that music therapists treat. They have neurologic music therapy. So for traumatic brain injuries, strokes, coma recovery, autism, Alzheimer's, Parkinson's, Huntington's, cerebral palsy, multiple sclerosis. So you can, I hope you understand that the all of these people benefit by cortical plasticity, but the fact that which we talked about previously. So how cortical plasticity will help in getting these injured brain parts better. So I will show a video which has several scenarios in different populations, and I hope you enjoy it. It's about 4 minutes long, but I will try to skip through it. There's an annotation if someone can take it.
Try it again. I'm Peter. I'm Peter. I'm Peter. How are you? How are you? I'm Peter. How are you? I am good. Thank you.
So you can see how music therapy has benefited speech therapy.
You are my sunshine, my only sunshine. You make me happy when skies are gray.
So this is a patient who has suffered a stroke, and here she has left cerebral neglect, and they're using music therapy to get that part, the left side again, to come back to normal. You can see this is an active form of music therapy. And this is another patient with stroke who cannot walk at the beginning. And this is his normal gait at the beginning. And now they're going to use music to improve his tempo. So someone's playing the guitar next to him and pacing with him. And they're speeding up the music and getting him to speed as well. So that was different applications of music therapy in recovery. Then I will give two more examples of music therapy in the elderly population, uh, I suppose not only elderly, music therapy and Parkinsonism disease. And they have also shown that music therapy can improve various areas of the patients with Parkinsonism. So here's another video which shows
sensors on you, because in this project we're definitely getting the speed of your walking, how far you
the shuffling
walk,
gait.
but from some of these sensors we can start to understand the quality of your walking and some of the biomechanics of how you're moving. Ready?
Patient with Parkinsonism.
Okay.
With shuffling gait.
One of the telltale signs of a Parkinson's gait is a small step length, kind of shuffling steps. There's a slowness of walking, and the intensity of walking is less. And so we use music in a way that is specific to helping the step pattern or the cadence.
It was structured in such a way because after the first couple of minutes of walking at a particular comfortable pace, they would play a song that would be much faster. So you would continually sort of ratchet up your speed based on the music.
The sensor actually measures the step pattern, and that gets fed back into an algorithm that takes the music and it expands or compresses the music so that the beat of the music matches the beat of the walking or the cadence.
So that is how advanced people are in this area. And then music therapy is said to be wonderful in treatment of dementia, and is said to activate the limbic system, the subcortical circuits, the emotionally related systems, and induce a sense of well-being and increase cerebral plasticity. So this is my final video, just to show you how music therapy is used. This is a patient with dementia. So you can see she's very slow and she can't remember. But now they're going to put headphones on. This is a song of her past.
When two lovers woo, they still say I love you, on that you can rely.
And you see the facial expression.
No matter what the future brings as time goes by, and the world will always welcome.
What was your childhood like?
So the same question was asked before and after music. What was your childhood like? So before music therapy, when she was asked, what was your childhood like? She couldn't remember, she couldn't tell anything. But after the music therapy, where you saw the whole emotional experience changed, this is a music that she knew from her past, and they played it, and she can give a better answer to the same question. So I hope this really showed what the world has done related to music therapy, and none of our country was in none of those systematic reviews, unfortunately. So what about our country? When I Googled Sri Lanka music therapy, there is a Ceylon Music Therapy Association website, but I don't think there are certified music therapists at all. And this, even though it's a University of Colombo program, it's not actually a course. It's just that they have done a session and they have named it as it's in their website. So our level is rather poor. However, we are currently doing research. I'm in a team with of doctors who are doing a research on music in autism and trying to get music therapy for autistic children. And so I have finished my time. So to conclude, I talked about music first, and then after that, we talked about what music therapy is and its different applications. And I think the most important thing is, since Sri Lanka lacks a lot of these things, and because music therapy is a relatively inexpensive, easy thing, and we might get a lot of volunteers to help us, I think we should establish this more in our medical setups in different forms. using evidence-based measures. So thank you very much. If you have any questions, please ask.
We have a few questions in the chat box. One question is, can we use music therapy for a child with dyslexia? And what kind of music therapy can be used? Playing piano, is it helpful?
So I'm not exactly sure about the music therapy in dyslexia per se, but I'm sure it will help. From my experience as a pianist, because we are when we do piano music, again, we use our left hand and our right hand. This is just my experience. I don't know whether it's right or wrong. We use our right hand and our left hand, and we are looking at music. So you will have the treble clef, which we usually play the right hand, the bass clef, which we play the left hand, and we are reading notes. And I believe children with dyslexia will actually benefit by it's an interesting question. We should do more research, but I believe music can improve that situation, especially if we use both our cortexes and both our sides.
Are there any proven health benefits from listening to binaural beats?
Again, I'll have to search for it. I'm not sure about that answer.
There's another question, madam. Is it okay to listen to music while studying, as most of the children do it now, whether it is beneficial?
Again, it depends on your personality. So unfortunately for me, I cannot study with music, because if I listen to music and study, I will forget about studying and sing with the song or do something else with that. But maybe music, I have actually read up on this as a student. Music therapy is, listening to music maybe at the beginning to calm down your system and get you into sit in one place to relax you and then calm you down and get you into the mood for study. And then maybe if it's still bothering you, you can probably slowly mute it away and then get into the studying focus. So again, it depends. Again, I would say a very relaxed music, something which is not catchy. Something without any lyrics, because if you have lyrics, you're just going, you will listen to it. So I think there are many YouTube videos with relaxing sounds. So sounds, music, something not familiar, may be able to calm you down and give that effect.
Is there any specific type of music to use in depression patients to reduce their anxiety?
Again, I'm not exactly sure. I'm so sorry because I have not studied music therapy in these specific areas. But again, from my experience, I would say it depends on the personality. So it can be cathartic, where if you have depression, if you want to get the ventilate your feelings, probably a sad song, angry song, and get the ventilation out, and then relaxing music to get the stress levels down, and then happy music to get the endorphins high and the dopamine high. So I wouldn't say there are specific music, but it's a good research area. I probably have to see exactly about what music is used in depression.
Madam, there's a recurring question regarding a pathway to upgrade our knowledge with proper certification with regard to music therapy. Is there any way doctors can do something like that?
As far as I know, there are no pathways in Sri Lanka. Correct me if I'm wrong, because I was also interested in finding out this. But there are no certified pathways. But I suppose if you have a background in music, if you have a degree in music, and if you suppose get another degree in counseling and maybe do your own research into these areas, probably you can have a research degree in that area. maybe you can use it on your, officially, I suppose, use it as in your pathway. But as of now, there is no official certification.
All right, madam, that's it for the questions. So I'd like to express our heartfelt gratitude to Dr. Nilanka for this insightful and inspiring session on music therapy. Your presentation beautifully highlighted how music can go beyond just being a source of entertainment, how it can heal, calm, connect, and uplift. The way you blended science with emotion truly gave us a deeper appreciation for the therapeutic power of music. Thank you for sharing your expertise, your passion, and your time with us. We are leaving this session not only more informed regarding this, but also more inspired. Thank you, ma'am.
Thank you very much. And thank you, Shri, for inviting me. Thank you, Dimshik, for organizing it. Thank you, Dr. Udari, for moderating it. And thank you, Dr. Dineshan, for inviting me. Thank you.
Thank you, madam. So there's a link in the chat box. You can give your feedback for us through the link and answer the post-assessment question to receive your e-certificate for participation. So as a part of our ongoing weekly webinar series, we are excited to invite you to join us again next week, same time, as we discuss about another interesting topic. Stay tuned for details on our next speaker and the topic in our WhatsApp group. And until then, thank you once again for your participation. Have a good day.